My name is Mahima, and I'm a student at Nova Southeastern University within the Department of Public Health. This project focuses on improving health communication about recognizing pediatric obstructive sleep apnea in the Down syndrome population, a qualitative study. Down syndrome is the most prevalent chromosomal disorder in which an extra copy of chromosome 21 disrupts the development of intellectual abilities. Obstructive sleep apnea, commonly known as OSA, causes difficulty breathing during sleep due to blockages to the upper airway. Nearly 80% of children living with Down syndrome are afflicted by OSA, compared to just 2 to 5% of the general pediatric population. Common signs of obstructive sleep apnea include restlessness, trouble sleeping, and difficulty breathing, but these are often overlooked as cognitive impairments due to Down syndrome rather than signs of obstructive sleep apnea. In collaboration with the Sudden Cardiac Death Awareness Research Foundation, the purpose of this project is to identify barriers to effective health communication between caregivers and clinicians regarding OSA symptoms. Effective health communication can mitigate risk factors associated with pediatric OSA. In order to fully understand the perspectives of healthcare providers and caregivers, I, fo- I focused on facilitating focus group discussions and interviews with healthcare professionals. In May of 2021, I facilitated a focus group discussion with 8 caregivers from the Gold Coast Down Syndrome Organization, which is a nonprofit organization focused on empowering families who have children living with Down syndrome. I also interviewed a cardiologist, pulmonologist, otolaryngologist, dentist, and a pediatrician to understand the clinical perspective of caring for a child living with Down syndrome. The questions had been approved by the Sudden Cardiac Death Awareness Research Foundation alongside the Department of Public Health at Nova Southeastern University. As seen in this image, signs and of OSA often look different in the Down syndrome population. Children with Down syndrome have a pushed back jaw and an enlarged tongue, which expedites their risk of OSA. Furthermore, children with Down syndrome present irritability, impulsivity, and poor concentration. And this could be a result of obstructive sleep apnea, but often it's overlooked as a cognitive impairment caused by Down syndrome. Obstructive sleep apnea also increases the risk for sudden cardiac arrest, which is an unexpected death caused by cardiac pathology in patients who don't have a fatal condition prior to sudden cardiac arrest. 40 to 75% of children living with Down syndrome are already affected by coronary heart disease, and the combination of that alongside undiagnosed OSA expedites the risk of sudden cardiac arrest. Upon analyzing the data collected from the interviews as well as the focus group discussion, I realized that there are some needs from both sides in terms of health communication. Caregivers went on to say that there's minimal communication on the long term effects of OSA. They often rely on the internet to receive information rather than speaking directly to their healthcare provider. Caregivers also appreciated receiving both written and verbal communication on health topics, but there was limited communication on obstructive sleep apnea. Healthcare providers went on to share that there's limited time during health appointments to share information on health topics. There's also obscure diagnosis on OSA that takes place during primary care. As they're focused on providing holistic care, language barriers and limited knowledge and caring for children living with Down syndrome serves as barriers when developing a treatment plan for children living with Down syndrome. COVID-19 has also impacted the lives of those living with Down syndrome. They're at a higher risk for COVID-19 infection, and as a result of this, parents are hesitant to take their child to seek healthcare in a clinical setting. Children being at home, they have become accustomed to a sedentary lifestyle and now lack motivation to engage in physical activity and promote a healthy lifestyle. The solution to all of this lies in public health efforts. As I move forward with this project, I strive to develop a health education program that trains healthcare providers on caring for children living with Down syndrome while providing caregivers with opportunities to learn more about signs and symptoms of obstructive sleep apnea in the Down syndrome population. When caregivers and healthcare providers have effective health communication, we can truly care for those living with Down syndrome. Thank you so much.